The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everyone. My name is Cami McElhenney, and I serve as the Director of Training and Education for the National Association for Civilian Oversight of Law Enforcement. I would like to thank you for joining us. As you listen to our speakers today, please let us know if there are any topics on which they touch that you would like to see further explored. It is our intention for this to be the first of many webinars we will have over the next months to help fill the gap and assist you in your work. Before I turn things over, I would like to go over a few things regarding today's call. All of you have entered the call in listen-only mode. As soon as we begin, however, you will have the ability to virtually raise your hand if you have a question for one of our panelists. This can happen by clicking on the hand icon on your control panel. When we get to your question, I will announce your name and unmute you so that you can ask your question. Please limit your questions and comments to no longer than 2 minutes so that we can get to as many people today as possible. If you would feel more comfortable, you may also type your question in the chat box and then send it to the webinar organizers. During the webinar, you may also send any questions you might have for me as the webinar administrator in the same manner, and I will answer your questions as quickly as possible. With our housekeeping duties out of the way, I would like to introduce you to today's moderator, Kathleen Beltz, an Assistant Inspector General with the LA County Office of the Inspector General, and a NACOLE board member. Katie?
Thank you all for joining us today for a critical discussion of strategies for prisons, jails, and oversight bodies during the COVID-19 crisis. Again, my name is Katie Beltz. I work with the LA County Office of Inspector General, and I oversee the LA County jails. We sincerely hope that some of the discussion today is helpful to you in your work. We have 6 esteemed experts with us today whom I will introduce briefly in order of presentation. Note that you'll be able to find their full exemplary bios attached under the Handouts tab in this platform, and as well later on the NACOLE website. Dr. Homer Venters is a physician and epidemiologist, and he is a nationally recognized leader in health and human rights. Dr. Mark Stern is also a physician and also a nationally recognized expert specializing in correctional health care. Michelle Deitch is a distinguished senior lecturer at the University of Texas at Austin. Professor Aaron Littman is a Binder Clinical Teaching Fellow at UCLA Law. Max Huntsman is the Los Angeles County Inspector General and my boss. Professor Sharon Dolovich, Professor of Law at UCLA. I've asked each expert to take 5 minutes to discuss their current work on COVID-19 issues, and then we will immediately open up for discussion. With that, let's begin.
Thank you. So I believe it's my turn to go first. Is that right?
That's right. Thank you.
Great. So hello, everybody. Thanks for taking time to come together. This is probably the busiest time for everybody here, whether you're listening, speaking. So it really is appreciated that you've come together to help us think through some of these issues. My name is Homer Venters. I have a background in correctional health and am thrilled and honored to be with some of the people who are listening and also contributing here. I just wanted to share some of my top level concerns for what is evolving as a looming disaster that will involve large amounts potentially of preventable deaths among people who are incarcerated in the United States. We have 5,000 county jails, state and federal prisons, and immigration detention centers. And in those places, we have put lots of people who fit the risk criteria we've been hearing about for the last few weeks for serious illness and death with COVID infection. We then also in these places have both physical plants and day-to-day operations that promote the spread of communicable disease. And we have worked hard over the last several decades to keep the health systems in these places separate and apart from our community structure, the CDC, the Joint Commission, our state and county departments of health, all the things that promote quality for us in our healthcare in the free world. Those structures and metrics and evidence-based practices are often lacking in these places. So my fear is that we are on the cusp of uncovering what we have done to the people who go into these places and also to ourselves ultimately as we make a national effort to curb or flatten the outbreak that we're in the middle of and also work very hard to keep our hospital systems from being overwhelmed. So one of the pivot points that's happened in the last week in many parts of the country is that we have infections, COVID infections, in many jails and prisons, and I think ICE detention centers. So the original set of interim guidance and policies that we saw 1 or 2 weeks ago in many places, that was focused on asking people if they had travel contacts, trying to figure out, is there a way to keep this virus from getting into these places? In many facilities, it's there. People are symptomatic. The facility managers are working hard to cohort people, the sick from the well. One of the things that I'm concerned about is that I don't see either the capacity or the practice of finding people who have these risk factors and trying to put special protections around them when they're asymptomatic. And that's really critical, because if we think about 100 people who are in a detention center, probably if all of them became infected with COVID-19, most of them would get better. But we know enough to know that some of them are at real risk for serious illness and death. And so one of the things we need to do much better with is identification early on of people who have risk factors, and then getting special protections around them. The most effective being to get them out of these places. But after that, when people are behind bars, it's to get extra measures of surveillance around those high-risk folks. The final thing I'll say before I toss it over to my colleagues who have incredible experience, and I'm really eager to hear what they have to say, is that I'm terribly concerned about the path to hospital care for patients who are in jails, prisons, and ICE detention centers. Most of you are familiar with the laborious, challenging path to take one patient from a jail or prison or ICE detention center and get them into an inpatient setting. 2 correctional officers going, lots of gear, lots of logistics. When a facility gets 5 or 10 or 15 patients that need that level of care, and there is also a serious staffing shortage because correctional staff are out and health staff are out, my fear is that very quickly we're going to have patients die in these settings who would have been saved had they had access to inpatient care. And so that focus is not just the responsibility of the correctional administrators. This must be a priority for every governor and the CDC as they manage the entire state and national response. The way they look at long-term care facilities, they need to be looking at correctional patients and how extra capacity can be created in hospitals to ensure they get the same level of care that everybody else does. Thank you.
Thank you, Homer. Mark, can you please pick up where Homer left off?
Sure. I'm going to first echo everything that Homer said. It's really on point, and those are things that we all need to take into account. I'm going to hit 5 quick points. First, and perhaps most important, it's critically important that correctional institutions and local public health departments are, as I call it, joined at the hip right now. As Homer was saying, we have a history of the correctional system and the public health system being separated. And this is one of those times when the words of our former Surgeon General come to mind of public health is public safety and public safety is public health. And we have to be working together. Jails need to be, and prisons need to be in close contact with their health departments, and the health departments need to have the jails and prisons at the table, just like they would the hospitals and the nursing homes. So that's one major point. Second thing is that communication is so important within the jails and prisons right now. Communication between the administration and both the staff as well as the residents. Residents of jails and prisons are pretty resilient. They'll put up with a lot of things, but they're all scared also, just like we all are. And the more communication they get, even more than daily, twice a day or 3 times a day is not too much. You can overdose on a lot of things, but you can't overdose on communication. The third point I want to make is touch on steps that can be done to reduce spread of virus within the facilities. And Homer hit the most important point. But beyond that, it's important that facilities are taking hygiene measures. Soap should be freely available to residents. They shouldn't be charged, or they shouldn't be limited to 1 bar of soap a month. Cleaning supplies for somebody who wants to clean their house should be readily available. I just heard a story of somebody of a place where they have to use one rag among 3 or 4 people to clean a cell. That's not good public health. Housing, different activities, visitation, and regular activities where people interact in close contact within a facility need to be reduced. And as much as possible, there needs to be social distancing, just like the CDC recommends. So, for example, there are creative things you can do, like if there are a bunch of people living in one unit and there are tables out in the common area, you could have staged meals where 1/4 of the people come out for a meal. One person sits at a table. There's still an opportunity for social interaction, which is so important. And then that group goes back, clean the tables. The second group comes out, has a meal. So there are ways of implementing social distancing in correctional facilities. It's not perfect. It doesn't create an environment like being at home, but it's better than people being crowded. The fourth message is about managing the patients within the facility who do get ill or might be ill. So it's really important for our correctional officers to be attentive to symptoms of somebody who may not understand what the symptoms are. Remember, we also have a high concentration of folks who have mental illness and may not be getting the communication message about social distancing. And that's where the officers play a really important role in keeping an eye on people and saying, hey, why don't we send you over to see the nurse? As soon as somebody's identified in a facility that has symptoms, especially coughing, I would hope that an officer would give them a mask before we walk them through the facility. When they get to the medical unit, I'm hoping that medical staff prioritize people who are in the groups that Homer mentioned a moment ago, and people who have symptoms that suggest that they might have the infection. We have to be careful in the way we phrase prioritization, though, because sometimes these messages get miscommunicated. We don't want somebody, for example, with crushing chest pain to have to wait behind somebody who has a little bit of a cough. But there also should be no waiting areas in the medical unit. So we should try to stage people so that a patient comes in, gets seen, goes back, another patient comes in, or at least is kept at a wide distance. Telemedicine is a tremendously valuable tool right now, and the federal government has relaxed its requirements for HIPAA compliance so that we can use even FaceTime, not only between a facility and an outside physician so that we don't have to transport, but even within a facility to avoid movement. We could have a nurse or a doctor look in on a patient for some symptoms from a distance without moving that person through the facility. And then the last point I want to make, which is kind of the flip side, again, of what Dr. Venters mentioned a moment ago. He described the urgent need for us to downsize facilities right now so that people who are high risk are not in the facility if at all possible, and so that we increase social distancing room. That's the first wave. I anticipate, we all do anticipate, that there may be need for a second wave of downsizing when staffing becomes a challenge in our facilities. Officers, nurses, other staff are members of society. They have child care problems. They have other members of their family who may be quarantined or isolated. They themselves may get ill. And I fear that very soon, we've already seen a little bit of it, that staffing may be reduced. And when that day comes, we need to be prepared to downsize the facilities. Jails are a little bit easier. Prisons are more difficult because those decisions come from judges and take more time, or from governors. So we need to be, in addition to the first steps that Homer described, the second step is we need to be prepared quickly to further downsize when staffing becomes an issue for the safety of the residents as well as the safety of the staff. And with that, I will pass the microphone back to you.
Thank you. Thanks so much, Mark. Michelle.
Great, thank you. Good afternoon, everyone. Thank you both, Mark and Homer, for those super helpful and important points. I'd like to start with a simple reminder that we may be living in a time of unprecedented challenges for prisons and jails, but the Constitution is not suspended, human rights are not suspended, basic rules on how to run a safe and humane facility are not suspended, and the need for transparency is not suspended. So in the few minutes that I have with you today, I want to talk about ways that we could continue to keep those issues forefront in our minds, even as we implement and navigate numerous new restrictions and limitations. You're hearing a lot about restrictions that are being placed on the facilities, quite appropriately so, restrictions on visitation and activities, for example. But at the same time, we need to be talking about ways to mitigate the harms that are caused by those restrictions. We need to think about the ways that increased idleness and prolonged cell confinement can lead to tension and violence. And both of those things need to be prevented through mitigation strategies. So some of the things that we need to be thinking about is other avenues for maintaining family contact. If visitation is cut off, how can we be increasing phone calls and making those phone calls or video visitation free? We need to think about ways to deliver programs through other means, perhaps through tablets or video conferencing. One thing I'm not hearing talked about a lot, but I think is hugely important, is the need to emphasize de-escalation strategies right now. There's going to be very high levels of anxiety and tension, both among people in custody as well as the staff. And that could lead to very high stress interactions that could easily escalate to use of force. Those tensions need to be de-escalated to minimize the need for hands-on contact. Kindness and compassion are really they're needed throughout the facility right now. It's a time of high anxiety, and correctional administrators need to be emphasizing that to their staff during briefings. Staff also need to be avoiding any kind of behavior that increases the anxiety and fear among people who are incarcerated. They need to project a steady and calm demeanor. They need to provide that factual information, but they need to be trying to calm anxiety, not capitalize on it in some way. Another thing is that we need to be stepping up PREA enforcement and precautions. We need to be particularly observant for incidents of violence or sexual assault between cellmates, because prolonged cell confinement and tension could lead to increased levels of those problems. So we need to be taking all complaints about fears of assault particularly seriously. We want to try to, instead of eliminating recreation, just reduce the number of people who recreate at any given time, ensure that equipment gets regularly sanitized. We need to be looking at ways to increase the availability of mental health services for people in custody who may be experiencing increased mental health problems right now. We need to also be looking at increased counseling services for staff who are also probably experiencing a lot of high levels of stress about their work obligations right now. Another factor that I want to talk about is the need to increase information sharing and transparency. You heard Mark Stern talk about this a little bit already. But remember that people in custody don't have the same level of information that people in the outside world have about this virus. So they need to make sure that they are receiving updated and accurate information. Families are extremely concerned about their loved ones. They need more information about what's happening inside. And for those of you that work in the oversight world, remember that with few outsiders coming into the facilities right now, we need to make sure that those facilities are staying as transparent as possible. So we need to be looking at ways to provide information to both people in custody and their loved ones, perhaps a dedicated web page about these issues on the agency's web page. There could be daily media briefings from the corrections agency about new developments in the jail. Key indicators should be reported on a daily basis so that we could be seeing if there are any patterns that are coming up. Beyond that, I think that oversight bodies who are right now are limited in their ability to go inside need to be looking for other ways to get information out to the public. So for example, you should make sure that there's a free telephone line for people in custody to reach the oversight body. You need to have a direct line of communication to the correctional administrators so they could look into any allegations that you're hearing. You should be, the agency needs to be sharing its emergency protocols with the oversight body. And again, you need to be looking into those key indicators. Also, remember that families are a really good source of information for you because they're going to be in more frequent communication with their loved ones inside. So have some system for receiving and tracking complaints from family members, as well as from facility staff who may be contacting you. With that, there's plenty more ideas that we can talk about, but with that, I'm going to turn it over to our next speaker. So thank you.
Thanks very much, Michelle. Okay, Aaron, you are up.
Hi, thanks so much for joining us, and it's a real privilege to speak with you. I'm just going to try to share my screen here. Okay, I think that worked. So my work over the past week or so has been to try to compile for advocates and officials across the country the statutory provisions that exist already under state law that allow them to rapidly decarcerate. You know, as we heard from Dr. Venters and Dr. Stern, there is an urgent need to do this now, and there will continue to be a need to do this in the future. Ross McDonald, who's the chief physician of New York's Rikers Island complex, recently begged city leaders on Twitter, please let as many out as you possibly can. And I'm hoping to share some legal strategies for doing that with you all. I realize that this is normally more the province of defense attorneys and civil rights litigators, but in this moment of crisis, there's also an opportunity for oversight officials who have deep relationships with corrections officials to push them to take steps rapidly. The Board of Corrections in New York has done this, and I think there's a lot more scope and opportunity for that. So I want to go through some categories here of steps that people can take in different positions. I'm just going to show this spreadsheet to you, and a link has been posted. It's constantly being updated, so if there are other provisions that you're aware of, please feel free to send me them. So there are a number of categories here. The first and most straightforward is cite and release by arresting officers. The provisions that exist differ in different states. The scope of that power differs, but one critical way to reduce jail churn is just to stop bringing people who don't need to be in jail into the jail.
Aaron, for 1 second, it appears really small on my screen. I wonder if there's a way to zoom in a bit.
Let's see if I can do that. Did that? I'm not sure if there is. In that case, maybe we should stop sharing my screen and you can just see my face, and then I can talk about it. Maybe that's better.
And share it with us later. Okay.
Yes. Okay. So the second category is cite and release at booking. So in a number of states, sheriffs or other jail officials have the authority to actually override police decisions and release people on citation. Obviously preferable for them not to come into the jail in the first place, but if they do, they can be released at booking. There are also a number of states that have outbreak-related release powers, which have rarely, if ever, been used as far as I can tell. But some examples of these are Mississippi, for example, has a statute that says if any infectious or contagious disease shall appear in the vicinity of any jail, or if the appearance of such disease be apprehended, the Board of Supervisors of the county, or if it should not meet in time, the sheriff of the county, and et cetera, may cause the prisoners confined in such jail to be removed to some suitable place of security. So that would clearly allow transfer to a hospital, some other kind of confinement facility where people could be more separated, but also arguably would allow transfer to home confinement for certainly high-risk people, but also others in an effort to reduce density. There are a variety of other discretionary release powers that officials have, and these really vary by state, but I'll give you some examples. So Wisconsin sheriffs have long had the unreviewable discretion to determine who is allowed to participate in home confinement. State courts there have held that the sheriff manages the jail, the court does not, and so the sheriff is able to decide who should be transferred to home confinement. In Arkansas, a sheriff has the discretion to stop booking arrestees and release those already in custody when he or she determines that conditions in the jail have fallen below the constitutional floor. As Professor Deitch explained, the Constitution still applies during a pandemic, and when people are at a high risk of getting very ill and dying because they're in such close proximity to each other, this provision arguably applies. In Maine, a sheriff can assign to a community confinement program any sentenced prisoner who's not convicted of a sex offense or a particularly serious risk and has served at least a third of the sentence. So those are a few examples, but those kinds of provisions exist in lots of jurisdictions. There are also sentencing credits that are discretionary and furlough provisions as well. There are also overcrowding related release powers that many of you will be aware of, but this is an opportunity to push to use those, and in any case to reduce prisons no more than 100% of operating capacity, hopefully much less than that. Governors also have significant disaster related powers in addition to the clemency and reprieve powers that we are more commonly aware of. In terms of the reprieve powers, which are particularly relevant now and allow them to temporarily release people from prison, the NYU Criminal Law Center has put together a really good resource on that. That's available online, and we can share a link to that as well. That's another 50-state survey. So my goal here is to flag that there are lots of opportunities even before a state Supreme Court has ordered release, and hopefully more and more will do that over the coming days, to significantly reduce jail and prison populations, and to urge folks listening to evaluate those and see whether there are ways that they can work with the agencies they oversee to reduce population and keep people both inside the facility and outside the facility safer. Thanks.
Excellent. Thanks so much, Aaron. Folks, we have Max Huntsman joining us. Unfortunately, we aren't able to get him via webcam, but we do have him via audio. Max, are you there?
I am here. Can you hear me?
Yes.
Excellent. I want to agree with what's been said a number of times, that letting people out of custody is the best solution to what we're facing now. Certainly nonviolent people, as to people who are particularly susceptible, at-risk individuals based on age or medical condition, removing them from the jail is the best solution. Both the reduction in population is important for public health, but specifically the removal of people who are at risk when they are nonviolent is critical for their health, because we expect it is likely that COVID-19 will get into the jails and prisons, those that it isn't already in, and it is likely that it will transmit within the prison quite a bit. The reason for that is you've heard words from the panelists so far like hope, should, and need to describe conduct inside custody facilities. Well, those are aspirational words, and the reality is that in most of our facilities are overcrowded. We've made efforts to reduce that. In some places it's happened, but in most places it hasn't. Even in areas where jails or prisons are not overcrowded as such, they tend to be understaffed. So it is difficult to imagine all those procedures that should happen actually happening. So that is why I believe removal of people when possible is the best course of action to make the population much lower. In Los Angeles, our sheriff has already started releasing people. We're down from over 17,000 in our custody facilities to a little over 15,000. It's not enough, in my opinion, but it's a start. We're greatly reducing the number of people we take in every day from 300 bookings to 60 bookings last I checked. So as a result, we're cutting that down. You heard another word here today, churn. And I think that's a critical word. On Friday, 1,600 of our prisoners were transmitted to court and 1,400 came back. And that's churn. That means all those people had a chance to be exposed and to bring back into the jails the virus. The CDC yesterday came out with interim guidance on how to avoid spread into and in custody facilities, but the detailed procedures are not necessarily being followed. For instance, checking temperatures on people who enter, including staff, including everyone else. So because those procedures are difficult to follow in a crowded jail, it's so important that we reduce the size. And again, I mentioned violent versus nonviolent, because what we're talking about is something that has to be acceptable to the public. There's a national discussion right now about how long we're going to keep our shelter-in-place procedures going at a national level. And the two sides of the argument are epidemiology versus economics. Now, that's a political matter for our country, but it's a very practical matter for those of us who are directly involved in individual governmental systems and custody facilities, because the same economic forces that push against long-term shelter-in-place orders push against our ability to provide appropriate care to people inside custody facilities. They always do. I know we don't want it to be that way, but that's the reality. Which brings me to what we can do about it as oversight professionals. As you already heard, we need to keep doing our job because we need to protect people who are inside. We also need to provide a level of public confidence by continuing to what we do, sort of a normalcy and an understanding for the prisoners inside and for the public in general, that there's a civilian oversight of law enforcement that continues even in an emergency. Because if people believe that law enforcement tosses the rules out the window when there's an emergency, that will be a problem for all of us. In Los Angeles County, we've just received an executive order from our board. Although our California law requires public meetings, there are exceptions for emergencies. As you've heard already, some of the summaries of states. If you're in a particular state and you're dealing with this, crack open a law book, and I think you'll find that there are laws written to cover this situation. So we have an executive order in place to help us work with the public health officer to assess the jails, to make orders as appropriate. Our sheriff has the ability to release people. The sheriff could release everybody tomorrow. It's not going to happen because of a public safety concern, but you have to understand that the potential is there, and we as oversight professionals can act as coordinators to use our persuasive authority within a governmental structure to empower the doctors who are telling us what we have to do to keep everybody safe, and empower those law enforcement professionals who are trying to deal with this problem. Here in LA, as I mentioned, our sheriff's department is really making a strong effort to release people, and we've attempted to empower that, first by working with county counsel, who provides the legal advice, such as the summaries you just heard, to get the law enforcement empowered to do that. And then secondarily, to work behind the scenes with governmental officials to make sure that our medical professionals, who are bureaucrats as well, right? We all work for a government, those of us on the inside. And so we have to accept that there's both the medical question, but also the resources and bureaucratic issues. And we can help with that. So we've worked in my office very closely with the various parties to get the orders that are needed from the doctors, the resources from the Board of Supervisors in our case, although it's different for every jurisdiction, obviously, to make things happen. And then finally, the buy-in of law enforcement. And by bringing those different parts together and getting them to work together in a collaborative way so that we can get the best result possible, I think that's what oversight can do in this emergency moment. I think it also reinforces for all of us how important our role was before this hit us. I wish we'd done a better job up until now and gotten our jail numbers down before today. But now today we have to deal with the reality we're in. Sometime in the future, we're going to have a chance to look back, learn lessons, and hopefully improve our systems so that the next emergency we're a little bit more prepared for, and so that on a day-to-day basis, the medical care that people receive in custody is improved. Thank you very much.
Thanks very much, Max. Sharon.
Yeah, hi, everyone. Glad to be with you. So I just have a few minutes, obviously, so I'm just going to try to do two things. One is I want to say some things about the Constitution and the court. So Aaron and Michelle already mentioned the Constitution. I want to say a little about that. And then I'm going to show you a resource, a second UCLA resource. Aaron's was the first. I'm going to show you a resource that we created at UCLA to try to keep track of all the fast-moving developments during this crisis. Okay, so first thing about the Constitution and the courts. In my life, I spend a lot of time on protections for people in custody, which prohibits cruel and unusual punishment. So not surprisingly, I've been thinking a lot about that over the past however long it's been that we've been living with this, a week, 10 days. So here's something you might ask. You might say, isn't it self-evidently cruel and unusual punishment to keep somebody who's only been sentenced to the deprivation of liberty, if they've even been sentenced at all, to keep them under conditions that will expose them to a potentially fatal virus. So I think the answer is yes, it is self-evidently cruel and unusual punishment, at least to me. And I think many courts would agree, not all courts, but I think many courts. So then the question is why this intuition isn't doing much work for us right now. And the reason is that in practice, the Eighth Amendment can only do so much. And I just want to say a little bit about why that is. So the first thing is that even if a court were prepared to find the current situation unconstitutional, there's still the question of what kind of relief the court could order. And over the past about 25 years or so, the Supreme Court and Congress together have progressively curtailed the powers of the federal courts to make meaningful changes to prison conditions, especially through population reduction orders, which is really what we need right now, right? The biggest problem we face, as people have been saying, is that every prison and jail in the country pretty much is overcrowded, and you can't practice social distancing in an overcrowded facility. So to really address the scale of the coronavirus threat, we would need to dramatically reduce the population of people in custody. And under current law, it is a very heavy lift to get a federal court to order a population reduction. And this is why advocates right now are in the position of trying to strategize every possible way to get 10 people out here and 50 people out here and 75 people out here, because the most obvious route, which would be to go to federal courts around the country to get population reduction orders, has been foreclosed by law. So even apart from the limits on remedy, there is a second reason why the Eighth Amendment really hasn't been playing as much of a role as you might expect or hope. And the reason has to do with how courts have learned to respond to Eighth Amendment prison conditions claims more generally. So it turns out over the past 40 years or so, the Supreme Court has pretty much stripped the Eighth Amendment of much of its moral content. And as a result, courts have learned, they have really been trained to look squarely at conditions that any layperson might think, wow, that is brutal and inhuman, that must be unconstitutional. Courts have learned to look at those conditions and say, there's no Eighth Amendment problem. And this is in part why we are where we are right now, right? As everybody has been saying, it isn't like the current crisis came out of nowhere. The conditions that are making jails and prisons incubators for the transmission of this virus have been in place for years, right? Overcrowding, understaffing, grossly inadequate medical care, inadequate sanitation, not even providing people the means to maintain personal hygiene, right? For decades, plaintiffs have been going to court to argue that these conditions are unconstitutional, but for the most part, courts have found no constitutional violations except in the most extreme cases, and that's because of the way the Supreme Court has crafted the legal standards for Eighth Amendment violations. Now, this isn't going to surprise anyone who knows anything about constitutional law, right? The Constitution has never been a magic bullet, but my point now is that it should really bother us, right? That it should bother us that the Eighth Amendment prohibition on cruel and unusual punishment cannot help us right now. And so here, I guess I want to make something of an aspirational point. And here's the point. In our own thinking, we do not have to restrict ourselves to the narrow, minimalist constitutional interpretation like the one that the federal court is working with today, right? This is there's a public relations dynamic to constitutional meaning, right? And this moment actually offers us an opportunity to re-infuse the Eighth Amendment with meaning, right? It's an opportunity, and I guess I want to suggest that if it's at all possible to keep the longer term view in mind during the present crisis, I want to encourage everyone in every public statement, in every advocacy letter, in every filing to argue that the Constitution demands immediate steps to keep people safe from the virus while they are inside. And the basic idea is that if the courts don't want to hear it directly, we should all collectively be taking our case to the court of public opinion to try to change the collective sense about what the Constitution means. So that's what I want to say about the Constitution. And now I just want to take a minute and briefly show you the spreadsheet that I mentioned. And let me see if I can do this here. Sharing, sorry, it'll take me a second. Here we are. I hope this is the screen share. Is my screen, is that working? Can you see the, yeah. Yes? Okay, great.
It's also, but it's legible.
Is it legible? I don't know how I can make it bigger, but I guess what I just want to show you all is, I dropped a link into the chat and Cammy's going to distribute it. This is an open source doc that's tracking all kinds of developments related to COVID-19 in jails and prisons. I'm going to ask everybody, if you have information to add to the spreadsheet, please add it. If you know people you think might benefit from having access to it, please share it widely. And I'll just show you quickly, we have a few tabs if you look at the bottom. I'm not going to go to all of them, but we have a tab that's tracking what facilities are doing to screen and also the number of confirmed cases. As cases emerge, please come in here and fill them in. We also have a tab on what policies are being adopted inside, limits on visitation, and this is really the key. There are two key tabs. One is all of the requests that people have been making to bodies to reduce the population, and we're also tracking the responses. So what prosecutors are doing, what sheriffs are doing, what judges are doing, what governors are doing. And I'm just going to ask all of you to post and share, and hopefully this will be of some use to you. And that's all from me.
Thanks so much, Sharon. Thank you, everyone. Cami, can you just quickly instruct folks on how to ask questions?
Yes. Again, if you have a question, go ahead and hit the hand icon on your control panel. That will alert me that you do have a question. And then once we get to your question, I will announce your name, unmute you so that you can ask it. And we just ask that everybody limit their questions or comments to 2 minutes and not more, so that we have time for more questions. If you feel more comfortable, you can also go down to the chat box. You can type in your question and then send it to the webinar organizer, and then I'll be able to read the question to everyone.
I'm just going to start with a really quick question related. Doctors, Venters, and Stern, Homer and Mark, we talk about these very important issues about early identification of those who are vulnerable. We hear about many risk factors, including age, respiratory, immune system issues. It's safe to say that we're officially in utter crisis inside of our facilities, given the extremely close quarters and the overcrowding, and also what has become an utter dearth of supplies. So, number one, how do we really prioritize vulnerability and risk factors, even in terms of the top few? We don't want to sort of misrepresent the importance of prioritizing things appropriately, and then also, how do we deal with rationing supplies? For example, in LA, we're giving people masks. I think we're actually having to use N95 masks. We don't have enough surgical masks at the moment to be providing folks with those as we escort them to the clinic for evaluation. So if one of you can please talk about risk factors in order of priority, and if someone can talk about how best to ration supplies.
I'll take Homer?
Oh, go ahead.
Yeah, so I'll take a crack at prioritization. I think it's terribly important that these decisions be made at a local level. Even when we talk about detention centers and federal facilities that have an attachment to Washington, D.C., public health is largely local. And I don't have a good answer I don't have a formula for which patient to put out based on their medical need, the conditions in the facility, and the legal considerations. That's why I think it's critically important that people be working as a team, the criminal justice team, along with the healthcare team, to make these decisions that make sense locally based on those factors. Let me take a breath there, see what Homer has to say.
Yeah, I think the thing I would add, I completely agree with that, is that every one of these considerations is eased when there are fewer people in these facilities, and particularly fewer people that we're worried are going to die. The urgency of this situation is that we are confident that lots of people who are at high risk for serious illness and death are in places where these infections will rattle around with a limited ability to mitigate the spread. And so, to the extent that there are fewer people, we need supplies, and if there are fewer people that we're worried are going to die when these infections arrive, and they will arrive, that will help us manage much more judiciously the use of all our staffing resources, our physical plant, and our PPE as well, and our local hospital resources.
Thank you.
I'm going to add one, address the supply issue for 1 second, and that is it's critically important that people follow the recommendations of CDC on top of any local recommendations for use of PPE. There are some situations where people, I hate to say, are overusing them and maybe using them, using up supplies that are needed for other purposes. I'll also say that the prison industrial complex is trying to step up. I know here in Washington State, our prison correctional industries just yesterday started working on producing masks, and I also was in communication with the comparable department in Florida that is also looking to do that, and some others may be. So our own system may be helping us out of the supply shortage.
Thank you. Cami, would you like to get to one of the questions? I see we have a few.
Yes, our first question is one that was sent in via the chat. Adovo tablets have opened up their platforms for free calls, text messaging, and virtual visitation. Is there any indication that other phone providers will do the same in an effort to maintain contact with families? Also, discharge planning hasn't been discussed in the media but must be implemented prior to release, as many will go to homeless shelters and further exacerbate the public health crisis.
I think that I would like for Max to address that, and also potentially Michelle. Max, can you go ahead?
Okay, yes. The first one about the availability of telephone services. I'm not aware of a lot of offers, and regardless of whether or not the offers are made, our biggest problem is one of logistics. We are having trouble. I can't appear, my image can't appear to you on this webinar, and we tried to show some spreadsheets that are too small because we're all doing something in a situation where we're not prepared for. We're doing it in an emergency, and I really don't see us increasing our structural capacity for phone calls in a meaningful way during this emergency. In long term, should we set up systems whereby that works? Yes, but historically, at least in my jurisdiction, inmates have been charged excessive fees for phone calls. The system is designed to get money out of people in order to subsidize the cost of incarceration rather than to facilitate those communications. So we're behind the 8 ball in that already, in the same way that we're behind the 8 ball in terms of population control. The other piece about having some place to go when you get out, yeah, that's absolutely true. In Los Angeles, we have a huge effort being made right now to try to reach out to the homeless population and try to get more people into temporary shelters that are being created. Again, same problem. It's a logistical nightmare to try to create the capacity. We were working on it before this hit, but we weren't there. And so as a result, we don't suddenly develop new capacity. We try, we increase it, but not by vast amounts. So are people doing that in my jurisdiction? Absolutely. Are they succeeding? I think to some degree, but is it sufficient to really slow things down? As doctors have said, we're trying to flatten the curve. I think that's the best we can hope for. I do think that on a positive note, that this crisis has caused people who would otherwise be resistant to some of these things to be much more enthusiastic. So we're getting a lot more support for shelters in places where we wouldn't. We're seeing law enforcement in support of releasing people who they ordinarily wouldn't be in support of releasing. So that's the good news, but the need is far greater than our capacity.
Thanks, Max. Michelle, do you have anything to add to that question?
The only thing I would add is that anecdotally, I certainly am hearing about jurisdictions that are making an effort to increase access to phone calls and video visits. I know that the Texas Department of Criminal Justice, Texas prison system is increasing phone calls. I've heard similar things from a number of different county jails as well. I think Max is right that the capacity is fairly limited in a lot of places to do that, but I do want to give credit to those jurisdictions that really are making an effort. And secondly, I can't emphasize enough the importance of needing to connect released individuals with social services that they're going to need on the outside, including medical care, housing, and food. We certainly don't want to be dumping people on the streets. So,
Katie, I have a couple things to say about that.
Great.
Can I jump in?
Yep, jump in.
Yeah, sorry, I wasn't sure. Yeah, so just two quick things. Excuse me, just on phone calls. The first is, if you look at our spreadsheet that I showed you, excuse me, there are some there's some info in there about different jurisdictions and providing free phone calls and how they're responding just to the communication with families issue. And the other thing to say is, this may be obvious, but of course, we don't want to be expanding the access to the use of the phones without adequate ways to sanitize the phones between people using the phones. And so one of the ideas that's been floated here in California is, and it's kind of radical for the prison, but I actually think it's very apt, is to provide people inside with burner phones. And there's a way that you can have them just program a single number. So you can give people phones that they can only use to call their family only. Or you can, as long as you're keeping them clean, you can give it to somebody for an hour and then get it back and make sure you can decontaminate it before giving to the next person, although that's labor intensive. But I mentioned the burner phone idea just to suggest that this is a kind of opportunity for creative thinking in the crisis, and also in a way that could push on the way we think about people in custody communicating with people on the outside once this crisis has passed, sort of breaking down the walls a bit more.
Thank you, Sharon. Aaron, you wanted to jump in on this?
Just to weigh in briefly, I've heard that in some jurisdictions there's been pushback about expanding free access to video calls in light of contractual limitations. And I would just point out that all states have very clear disaster relief provisions that allow local officials and governors to get out of such restrictions. And so if that's something that you're hearing, I would look into that.
And I would just also quickly add that GTI, the provider that we use in Los Angeles County, my understanding is although we haven't verified this independently, is offering two free calls, I believe, per week to each person who is incarcerated. Cami, do you think we should, with just about 8 or so minutes left, should we jump to maybe Jenny's question? Or is there another?
Sure, we have several here that are waiting. So we do have a question from Ivan Zinger. And so I'm gonna unmute you. Okay, hopefully, Ivan, you should be able to speak now.
Oh, can you hear me now?
Yes, we can hear you.
Okay, sorry, I'm new to this app. So I'm the correctional investigator, which is the federal prison ombudsman for Canada. And I oversee, in terms of external oversight, 43 penitentiaries across the country with about 14,000 inmates. The situation right now is much better in Canada right now, at least at the federal level. We don't have double bunking, we don't have overcrowding. There are no cases so far of the virus. One thing that I'd like maybe the panel to tell me more, I'm happy to actually maybe in the future, if there's another webinar, an opportunity to talk how my agency has regrouped and trying to provide that necessary external oversight, especially in the situation where there are no more external eyes on inside penitentiaries. So no more visitors, as you know, but nobody's going in, no volunteer, no. We have these advisory committees. Nobody's going in, so it's critical for us, for the last eyes into those penitentiaries, to keep an eye on things. So I'm happy to provide a sort of how we got organized. But my question, and I haven't heard very much around screening and testing. So I would like to hear more from the panel, if it's possible.
Dr. Venters, would you like to pick that up? Or
Sure, thanks. So I think that we're seeing a shortage of test supplies and test kits all over the United States. And this is certainly reflected in the PAR levels, or the numbers of test kits that are in jails and prisons, I think that as we see cases spike in one facility and regionally, that's going to reflect what's happening in the community. There are critical decisions about whether or not everybody who's symptomatic should be tested. And so, you know, following the advice of the CDC, there is a very concerted effort to find everybody who's symptomatic, to get them into cohorted settings where they don't transmit infection, and also to assess them for testing and hospital transfer. And so that approach, I think, is present on paper. I think that many facilities actually struggle with just that basic approach, in part because in the United States, we have many, many facilities that are so full. I talked to somebody in a state DOC in the South that said they were at 175% of capacity. So just the ability to put the sick people in one spot and the not sick people or asymptomatic people in another spot is virtually impossible for them. And of course, when you do that, you usually try and clean all the facilities to put, you know, the housing areas to get cleaned and decontaminated before you put people in there. So we face struggles. I think that testing will be an important part of this. I think that as test kits come in, we'll get more positives coming out. You'll see the correctional officers get positive tests first and then the patients after them. But I think that we're just getting test kits into these facilities now.
Thank you, Homer. Cami, do we have anyone, or Mark, did you want to jump in on that? And then Cami, if we have any more hands up, we can move on to that after Mark.
Yeah, just one quick comment. Ivan, great to hear your voice. One caution about testing, and this is kind of at the extreme, but we can over-test also. I think right now we're way under-tested, and we really, as Homer said, need more supplies. But there is a little bit of a caution from public health standpoint of testing the wrong people, which will use up valuable resources and may give some people a sense of security that is may not be justified. So we just have to be careful to use tests the way they're supposed to be used when they become available.
Thank you, Mark.
The next question we have is one that someone wrote in. I'm a public policy graduate student. Is there anything that concerned civilians can do right now to push these efforts forward?
I think I'd really like to hear from Aaron on this initially, and then perhaps if others would like to jump in. And Aaron, if you can also talk about this a little bit in the context of statutory authority, and potentially Sharon in terms of talking about what avenues we might have through the courts.
I think the answer to that is absolutely. There's a tremendous amount that people can do. There was a not necessarily suggesting this, but there was a protest outside the Cook County Jail that involved a socially distanced crowd requesting that people be released, but spaced well apart. A lot of these powers are powers that local officials have, and local officials are elected and are accountable to the people who vote for them, and they need to be urged to rapidly decarcerate. One critical argument that needs to be made as much as possible is that this is essential not only for the health of people who are locked up, but for the health of correctional officers and for the health of the rest of us who will be infected when there is massively widespread transmission inside correctional facilities that then leaks outward. So we can all stay home and shut our economy down, but if everyone inside a jail is getting infected and coming in and out, that's going to be a huge source of infection for everyone in the local community, especially in a rural area that may be able to effectively control this, except that all of their employment is in a local prison. And so people keep coming in, people keep coming out, infect their family members, and things get worse and worse. So, you know, anything that concerned citizens can do is incredibly valuable.
Thanks so much. Cami, do we have a quick second for Sharon, or do we need to just cut it off? We're at about 1 minute now.
Sorry, let's go ahead and hear from Sharon. Let's finish this one out.
So I would echo everything Aaron said, and just on the courts front, I would just go back to what I was saying about the Constitution. The laws give courts and other legal actors a lot of discretion, And the more of an imperative they feel from the public to act, the more ready they will be to use whatever legal authority they have. And so if you can advocate, I mean, demonstrate, write letters, make phone calls, talk to your local media, try to get stories in the papers, as much as you can, keep this issue in the public eye, and you will see that it will have effects on how the available legal levers are used by the officers who can use them.
Thanks so much, Sharon. With that, this is just the very, very beginning of what is clearly going to be a much bigger and longer conversation, hopefully that we'll all be able to have together, potentially even in this forum. Thank you so much to our panelists, Michelle Deitch, Mark Stern, Sharon Dolovich, Aaron Littman, Homer Ventures, Max Huntsman. We greatly appreciate you. Cami, would you mind just quickly closing us out with letting folks know about how they can get this information on the website, et cetera?
Of course. So following the end of this event, I will be converting the video and posting it to the NACOLE website as soon as possible. But I'll also be sending out a follow-up email to everyone who attended today with the links that were provided by Aaron and Sharon, and then also the link to the web, please, or to the recording. Please feel free to share that widely. Also, my contact information will be in that email. So if there are other things that you would like to see, to dive deeper on, that we were able to just touch on today, please let me know, and we'll continue to do what we can to get the information out to all of you. Thank you again for attending today. We appreciate it.